Mycobacterium tuberculosis. This is the organism that is involved in the causation of the most fatal disease, that is the tuberculosis. The term mycobacteria means these are the organisms that resembles fungus-like, and hence fungus-like bacteria, that is mycobacteria. These organisms are usually slender rods. They show branching filaments and branching filaments which are similar to that of the fungus. And in liquid media or liquid culture, they usually forms a pellicle that resembles mold-like appearance, and hence these organisms are usually designated as fungus-like bacteria. These organisms cannot be readily stained, but once stained, they do not easily get decolorized, and hence these organisms are called as acid-fast bacteria. That is, once they take up the stain, even after adding the decolorizing agent with dilute mineral acid, they do not get decolorized, and hence these organisms are called as acid-fast bacteria or acid-fast bacilli. The characteristic feature of these organisms are these are aerobics, they are non-motile, non-capsulated and non-sporing in nature. The growth of the organism is very slow in the media, which is a characteristic feature of this organism, and hence immediate reports should not be given for the cultural test. That is, if the organism develops within 24 hours, that is a negative report, because these organisms show a very slow growth rate and can take up to 8 to 12 weeks to grow in the ordinary media or the cultural media, and hence the report should not be given immediately for the growth of this organism. So this is one of the important characteristic feature of the organism among all the bacteria, that is they show very slow growth rate. And the genus of this organism, that is a Mycobacteria, includes a wide variety of organisms including the obligate parasites, opportunistic pathogens, and they can be saprophytes. Coming to the history, the first organism of this genus Mycobacteria was isolated by Hansen, which was a lepra bacilli, and the organism that causes the mammalian tuberculosis was isolated by Robert Koch. And with the help of his Koch postulates, he was able to show the pathogenic feature of this organism that is involved in the tuberculosis infection. Even though lepra bacilli was the first that was to be identified, but much studies have not been carried out because it is very difficult to cultivate in the laboratory. And Koch was able to isolate this organism in his media, and that is a mammalian tuberculosis, that is a Mycobacterium tuberculosis, and was able to induce this infection in the experimental animal and gave the Koch postulates. Apart from this Mycobacterium tuberculosis, there are other group of mycobacteria that are involved in the causation of the disease, such as Mycobacterium bovis. So these mycobacteria are together that are involved in the causation of the disease are called as Mycobacterium complex, and includes wide variety of Mycobacterium species that are involved in the causation of the disease. The most important being the Mycobacterium tuberculosis and Mycobacterium bovis. Apart from that, we also have another two important group of organisms, that is the Mycobacterium africanum, that has a important characteristic feature which is intermediate between the Mycobacterium tuberculosis and Mycobacterium bovis. And another important group of organism is Mycobacterium microti, which usually causes or exceptionally causes disease in the bones. So these all organisms which are related to Mycobacteria are called as Mycobacterium complex. And as already discussed, lepra bacilli was discovered by this is the second important group of Mycobacterium which was discovered by Hansen, though it was the first that was to be discovered, but it could not be studied more in detail because it was not easily isolated in the lab. And the third important groups of Mycobacteria that are usually isolated from the different sources are called as the atypical bacteria. This can be isolated from, or they are called as a mixed group of organisms that can be isolated from the avian groups or the cold-blooded animals or warm-blooded animals, skin ulcers, etc. So all these organisms that have been isolated from the different sources are usually included under the atypical mycobacteria, and they are usually obligate parasites and opportunistic pathogens. And apart from that, we also have saprophytic mycobacteria, which is that can be isolated from the butter, that is Mycobacterium butyricum, the Mycobacterium feli, which is isolated from the grass, and Mycobacterium sphegmatis. All these organisms, that is the three important groups group of organisms are included under the saprophytes. Whereas coming to the atypical mycobacteria, you can further classify them as photochromosomes, saccharochromosomes and non-photochromosomes based on their growth rate on the media and production of the pigments. So we have got three important groups of organisms, that is the Mycobacterium tuberculosis and the Mycobacterium bovis. We have a lepra bacilli, atypical mycobacteria and the saprophytic mycobacteria. All these organisms are usually included under Mycobacterium complex because they are in turn usually involved in the causation of the human diseases. Now we'll be dealing in detail about the Mycobacterium tuberculosis, which is the causative agent of the fatal disease, that is the tuberculosis. Coming to the morphology of this organism, these organisms are usually straight or slightly curved, and they show branching filaments, and depending upon the growth condition and the media, they show long filaments, and they usually form a mold-like pellicle on a liquid media. And this organism resembles similar to that of the fungus in their growth, and hence they are called as a mycobacteria. Sometimes these organisms show club-shaped structures, and branching is seen in a certain type of media where they exhibit the filamentous and branching type of growth. And this Mycobacterium tuberculosis can be distinguished with Mycobacterium bovis in that the Mycobacterium bovis usually are straighter, stouter and shorter in nature. So this is one of the important characteristic features of these two organisms that helps us to distinguish and identify the organism, as both these organisms are involved in the causation of the disease. So we should be able to identify the causative agent so that we can go for the further treatment. So the Mycobacterium tuberculosis are slender and slightly curved rods, whereas the Mycobacterium are usually straighter, shorter and stouter in nature. And when stained with gram-positive, they usually are gram staining, they usually stain as gram-positive. But we cannot take this particular characteristic because these organisms, once stained with the primary stain, they do not get easily decolorized even after the treatment with the dilute mineral acid, that is 20% sulfuric acid and absolute ethanol. So we have to go for special staining techniques to identify these organisms. They are called as Ziehl-Neelsen method, also called as acid-fast staining method, where the primary stain that is used is a carbon fustian, which is stained with the secondary stain that can be either a low flush methylene blue, or it can be picric acid, or it can be a malachite green. But the primary stain is a carbon fustian, which is immediately taken up by the organism. And even after treatment with 20% sulfuric acid and absolute ethanol, they do not get easily decolorized, and hence under microscope you can see them as a beautiful red colored bacillus under the microscope. So the special staining technique is called as the acid fast staining. And the acid fastness of this organism, or the characteristic feature of this acid fastness, is because of the presence of an unsaponifiable lipid waxy cell wall that is present in this organism, which is called as a mycolic acid. So it is because of the mycolic acid that this particular organism has the ability to resist decolorization once they take up the primary stain. So this mycolic acid is a lipid-rich waxy cell wall, and it is called as a mycolic acid. Now when stained, these Mycobacterium tuberculosis usually stain as uniform or granular, and they show beaded or barred forms, and this is a characteristic feature of the Mycobacterium tuberculosis. Whereas the Mycobacterium bovis usually stain uniformly. So this is another important characteristic feature that we can use to distinguish between Mycobacterium tuberculosis and Mycobacterium bovis. Now coming to the electron micrograph studies of the cell wall of this organism, the cell wall is a tri-layered structure having a trilaminar plasma membrane. So this is more complex when compared to the other group of microorganism. And we can create spheroblast from this organism and treat it with the lysozyme, and L forms can also be isolated or can be produced in the artificial conditions by treating with different types of acids. Coming to the cultural characteristics that helps us to isolate the organism as a pure culture in the cultural media. As we know that the important characteristic feature of this organism is that it grows very slowly in the cultural media or the artificial media, and the generation time is around 14 to 15 hours, and it can take up to 8 to 12 weeks also. So immediate report should not be given. So once they have been inoculated on the media, regular checkup have to be seen for the growth of of the organism once in a week or twice in a week, depending upon the characteristic feature of the growth of this organism. And this organism develops into colonies starting from 2 weeks. Before 2 weeks, they do not develop into the colonies into the media. And the optimum temperature for the growth of this organism is 37 degrees centigrade. Growth is not seen below 20 degrees centigrade or 40 degrees centigrade. And the pH requirement, the optimum pH is around 6.4 to 7. And these Mycobacterium tuberculosis are obligate aerobes, whereas Mycobacterium bovis is usually microaerophilic, but on further incubation or on subculture they become aerobic in nature. And the growth of Mycobacterium tuberculosis is luxuriously seen on the media, and hence these organisms are called as eugonics, whereas Mycobacterium bovis sparsely grows on a media. These are called as dysgonics. So based upon the growth characteristic, how they grow on a media, they can be classified as eugonic and dysgonic. This is another important characteristic feature that helps us to distinguish between the Mycobacterium tuberculosis and the bovis. And in order to enhance the growth of this organism, we can add to the media 0.5% grisolol that helps in actively growing both the type of organisms. And sodium pyruvate improves the growth of both the organisms. And Mycobacterium tuberculosis gets inhibited on a media containing para-nitrobenzoic acid. These organisms are not very strict in their nutritional requirement, but they are very sensitive to the toxic substances such as the fatty acid. And hence, when we are preparing the media, we should keep in mind that these fatty acids have to be neutralized with the serum or the serum albumin or the charcoal. And Koch first isolated this organism on his media, that is a heat coagulated bovine serum media. And nowadays we have got different types of media to isolate these organisms, ranging from a solid media to a liquid media. Coming to the solid media that is used to grow this organism, they have to be enriched, or they can be added with the egg, which is usually the name given is a Lowenstein-Jensen's media, or when added to the media, blood component is added, it is called as a Tashi's media. If serum is added, it is called as a Loeffler's media, or if potato is added, then it is called as a Polanski media. And the most important media to grow this organism, and that has been proposed by International Union against tuberculosis, was LJ media without the starch. So this media usually has the important ingredients such as the coagulated hen's egg, we have mineral acids, we have arginine, aspergine, and malachite green. The malachite green in this particular media acts as a selective agent inhibiting the other group of bacteria. So this is a selective media. There is a LJ media without the starch that is mostly used to isolate the organisms in the artificial medium. Now coming to the media, there are different types of liquid media which can be used to isolate the Mycobacterium tuberculosis and the bovis. Among the different liquid media, we can use the Dubers, Middlebrook, Proskers, and Webex, Sultan, and Sulas media. Coming to the growth characteristics of this organism, how do we identify this organism on a solid media? The organism Mycobacterium tuberculosis usually forms a rough, dry, raised, irregular colonies, which usually appears as creamy or white in nature, and on further incubation they become yellow or buff in nature, and they are very tenacious and not easily emulsifiable. Whereas Mycobacterium tuberculosis can be identified as they grow as a flat, smooth, moist, white, and they easily break up when we touch them with the inoculation loop. Now coming to the media, these organisms, as already discussed, they form pellicle on a media showing a mold-like appearance, and the pellicle usually starts growing from the bottom of the media, which creeps upward and forms a pellicle on the top surface, which can extend beyond or above the media also. And here in the case of liquid media, we can distinguish between the virulent stain and the avirulent stain. The virulent stain usually have the capacity to produce a long serpentine cords, and whereas the avirulent stain do not form these cords, but they are easily seen as dispersed colonies or dispersed cells. Virulence of this organism was initially thought to be due to the cord factor, but later on it was found that the cord factor is seen both in the virulent and the avirulent stain. But in liquid media, the formation of the pellicles helps in identifying the organism. Coming to the resistance of these organisms, as it is very important for us to know how can we easily kill this organism by exposing to various physical and the chemical conditions. So these organisms are not very heat resistant. They can be killed at 60 degrees centigrade when exposed to about 15 to 20 minutes, and when exposed to the sun they can be killed within 2 hours. And this organism has the ability to survive in the sputum for nearly 20 to 30 hours, and in the droplet nuclei they can be remain viable for about 8 to 10 days. And at room temperatures the viability can be seen for up to 6 to 8 months, and these organisms can be stored for 2 years at when kept at minus 20 degrees centigrade. These organisms are highly resistant to different types of chemical substances, that is, they can resist 15% phenol, 3% nitric acid, or 4% sodium hydroxide, etc. So they are very resistant to chemical substances rather than the physical agents, and sensitive to formaldehyde and glutaraldehyde, and can be killed when exposed to tincture of iodine for 5 minutes, and easily killed at a concentration of 80% ethanol. And hence ethanol is mostly used as a disinfectant for the skin, gloves and other important surgical instruments. Now coming to the biochemical reaction, which is another important characteristic feature that helps in identifying these organisms in the lab. So as we have different classes or the species of the genus Mycobacteria, we need to differentiate them in order to go for the treatment purpose or identifying the organism. So the first test that is usually carried out for the biochemical reaction is a niacin test. This test is used to differentiate between Mycobacterium tuberculosis and Mycobacterium bovis. The tubercle bacilli are usually grown or they form niacin or produce niacin when they are grown in an egg medium. And here the medium contains 10% cyanogen bromide, 4% aniline and 96% ethanol. And the development of a canary yellow color indicates a positive reaction. This is usually produced only by the Mycobacterium tuberculosis, which is of a human type. Apart from Mycobacterium tuberculosis, the other two organisms that shows positive niacin test is a Mycobacterium similae and few organisms of Mycobacterium chiloni, etc. Next test is aryl sulfatase test. This test is used to differentiate between the human type and atypical mycobacteria, which are obligate parasites or opportunistic pathogens. The media that is used to identify the atypical bacteria, because this test is given positive only by the atypical bacteria. The media that we use over here is a 0.001 tripotassium phenolphthalein disulfate, and after incubating we can add NaOH and NaOH dropwise, and the pink color indicates a positive reaction, which is given by the atypical mycobacteria. Next is a neutral red test. Here the organism that is a virulent stain, it is used to differentiate between the avirulent and the virulent stain. The virulent stain has the ability to bind to niacin in the alkaline buffered solution. That gives a positive test. Next is a catalase peroxidase test, again used to differentiate between the Mycobacterium tuberculosis and the atypical bacteria. It is a combined test, that is a catalase peroxidase test. Here in the case of catalase peroxidase test, atypical mycobacteria gives a catalase positive, whereas it is negative for the peroxidase, whereas the Mycobacterium tuberculosis is positive for the peroxidase. And here the media that is mostly used is 30 volume H2O2 hydrogen peroxide along with 0.2% catechol in distilled water is added to 5 ml of the culture, and seen for the effervescence and the browning. If the effervescence is seen, that is indicates a hydrogen peroxide, that is a catalase test, which is positive for the atypical bacteria, and if browning is seen, it indicates a peroxidase positive, which is for the Mycobacterium tuberculosis. And remember, the catalase and peroxidase activity is lost if the organism has become isoniazid resistant, and hence we should know whether the organism is a resistant organism or a sensitive organism towards the isoniazid. Another important test to identify Mycobacterium tuberculosis is the amidase test, and the Mycobacterium, all species have the ability to split amides of acetamide, benzamide, carbamide, nicotinamide and paraxetamide, and this splitting ability is seen only in the Mycobacterium tuberculosis or any group of mycobacteria. And the media or the chemicals that are mostly used over here is 0.00165 molar solution of amide is incubated with the organism at 37 degrees centigrade, to which is added 0.1 ml MnSO4 4H2O and 1 ml phenol and 0.5 ml hydrochloride solution, and the tubes are kept in a boiling water bath for 20 minutes. The indication of the color that shows positive is a blue color. So blue color indicates a positive test, which indicates the Mycobacterium genus, which has the ability to split the amides. Next important test is nitrate reduction test, which is again used to distinguish between Mycobacterium tuberculosis and Mycobacterium bovis. Here nitrate test is given positive by only Mycobacterium tuberculosis and negative for Mycobacterium bovis. Now, these are the different biochemical reactions that are mostly used to identify the Mycobacterium species. Starting from, we have niacin test, we have aryl sulfatase test, neutral red test, catalase peroxidase test, and amidase test. And last one is a nitrate test, reduction test. Coming to the antigenic property of this organism, which is the one that induces the production of antibodies. Though the antibodies are not mostly used in diagnostic purpose or the treatment purpose, but they do confer certain important properties to identify the organism. So antigenic property is usually the group specificity. Antigenic property is because of the polysaccharide component that is present in the organism, and the type specificity is usually exhibited by the protein antigen, which is an important component of the organism. And once the organism is introduced into the body, it has the ability to produce a delayed type of hypersensitivity reaction because of the bacillary protein, which is called as a tuberculin. And this tuberculin is nowadays mostly used to identify the infection with the Mycobacterium tuberculosis. And this tuberculin test is usually given positive for all the different types of the species of Mycobacterium, and hence we cannot take it into consideration as a diagnostic tool, because there is an antigenic relationship that is shared between all the type of Mycobacterium, and there is an antigenically homogeneity between Mycobacterium tuberculosis and Mycobacterium bovis too, and hence this particular characteristic antibodies that are developed against the antigens cannot be used in the diagnostic purpose, but sometimes they are helpful in immunodiagnosis to identify the antibodies against the proteins, phosphatide antigens and polysaccharide antigens. Now coming to the typing of these organisms, bacteriophage typing is mostly used for epidemic purpose, and there are different types of phages that can attack the mycobacteria. These phages are usually present in the soil, water, etc., and the phages that attack the mycobacteria are called as the mycobacteriophages. The important characteristic feature of these mycobacteriophages is that the phages do not get inserted into the host chromosome, forming a lysogenic cycle, but they have the ability to form a plasmid inside the bacterial cell, and hence it is called as a pseudo-lysogeny. And based upon the bacteriophage typing, you can classify the tubercle bacilli into 4 different types: A, B, C and I. I indicates the intermediate characteristic between A and B. So among the 4 types, type A is the one, or the phage A is the one that causes worldwide infectious diseases. Phage B is the one that usually causes diseases, especially in the Europe. Phage C is very rarely seen, whereas phage I is an intermediate that can be seen mostly in the Asiatic countries. And apart from these, we have phage 33D isolate, that is also one type of classification of this bacteriophage typing. And based upon the bacteriocins that are produced by the mycobacteria, they can be divided into 2 types. Bacteriocins are nothing but the antibiotic substances or certain toxic substances that are produced by the organism in order to inhibit the other closely related group of microorganisms. So based upon the bacteriocins cells that are produced by mycobacteria, we can classify them into two types. Now further ahead, as we know, the whole genome of the mycobacteria, molecular typing is more sophisticated technique to type the mycobacteria. So among the molecular typing, where DNA is used, we have DNA fingerprinting, and we have restriction endonucleases and restriction fragment length polymorphism technique and chromosomal insertion sequences. And DNA fingerprinting is usually used to identify the different strains, to distinguish between different strains. Whereas with the help of restriction endonucleases, which usually forms different lengths of the nucleic acid. So based upon this nuclear length fragments, we can identify the strain specific mycobacteria. And with the help of restriction fragment length polymorphism, it is mostly used for the epidemiological purpose, to identify the organism that is involved in epidemiological diseases. And last but not the least, the chromosomal insertion sequences. These insertion sequences are nothing but the transposons. So some of these mycobacteria have these insertion sequences called as IS6110. So based upon that, you can identify the type of mycobacteria. Now coming to the host stage, in which organism or in which mammals these organisms usually causes the disease. Coming to the Mycobacterium tuberculosis, they usually cause natural infections in the humans, primate and dogs. Whereas the cats or the rabbits are usually they do not get infectious with the tuberculosis. That is, Mycobacterium tuberculosis is non-pathogenic to rats, rabbits, etc. Whereas they causes infection only in the humans, primates and dogs. But they can be experimentally introduced into certain guinea pigs. And coming to the virulence characteristic, the virulence usually varies from one mammal to the other mammal depending upon his conditions, depending upon the immune status of that particular person, etc. So there is a variation in the virulence characteristics of this organism. Coming to the Mycobacterium bovis, it is more pathogenic to cattle than to the human, but sometimes can cause infection to the humans too. So they are more pathogenic to humans, cattle, etc. Whereas this organism is non-pathogenic to the fowls. And apart from this, the Mycobacterium bovis was the one that was usually used to prepare vaccines against the tuberculosis. So Mycobacterium bovis is the one that is used to prepare the BCG vaccine, Bacillus calmette urine vaccine, by growing this organism in repeated cell cultures, making it avirulent in nature and making a vaccine out of this. So Mycobacterium bovis is the one which is mostly used to prepare the BCG vaccine. Apart from these two types, as we have already discussed, there is another type of organism, that is Mycobacterium africanum, that usually causes infection only in the tropics of Africa. And this organism has a characteristic similar or intermediate between the Mycobacterium tuberculosis and the Mycobacterium bovis. Apart from that, Mycobacterium Asian type has also been isolated, that specifically causes diseases in the South India. And the characteristic feature of this Asian type is it is isoniazid sensitive, it is a phase 1 type, and it is sensitive to hydrogen peroxide, and it has low virulence characteristic. So these four properties are the one that helps us to identify the Asian type of Mycobacterium tuberculosis. And the last one is a Mycobacterium microti, that specifically or specially causes tuberculosis only in wolves, but it is non-pathogenic to other mammalian species such as the humans, dogs, etc. Initially, Mycobacterium microti was used to prepare the BCG vaccination, but because of certain focal infections that were caused by this organism, that have the use of making use of Mycobacterium microti has been abolished. Now coming to the pathogenesis, the most important feature of this organism, here the pathogenesis, that is the source of infection, is the open case tuberculosis. That is, if a patient who is suffering from this infection is openly moving in an area, he has the ability to transmit the infection or transfer the infection to the person who is in close intimate relationship with him, or who are in close distance with him. So open case of tuberculosis is the major source of transmitting the infection. It is said said that the open case of tuberculosis, the patient with this particular characteristic has the ability to transmit infection to about 25 contacts before his death or before he is treated up. So the source of infection is the open case tuberculosis, and the mode of the transmission of the infection is by the direct inhalation of the aerosolized bacteria which are present in the expectorated bacterium laden sputum. So here in the droplet nuclei, when he coughs or speaks, nearly 3000 infectious nuclei per cough are released, and they are enough to cause infection to many peoples. And here the person who is present at home and the person who are in close contact with him are easily getting infected with this type of infections. Apart from the inhalation, ingestion of the infected milk from the tuberculosis can also lead to the infections. That is, the milk, if it is infected and consumed raw in a raw form, then it can lead to the infection. And the pathway of this infectious diseases is that the organism enters via the upper respiratory tract, where the natural defenses that are present in the upper respiratory tract try to expel the organisms. Once they have the ability to overcome that, they reach the lungs, where the alveolar macrophages have the ability to engulf the organism. Now, there are a variety of factors that helps to in the outcome of the infections. The factors that are mostly included are the virulence of the organism, the dosage of the organism, the immune status of the person, the stress, the nutrition or the malnutrition, and there are other environmental factors, etc. So these all factors are usually involved in the outcome of the infection. And the characteristic feature of this organism is that it does not produce any type of toxin to cause the pathogenesis, but it has the ability to multiply in the alveolar macrophages. And the virulence is usually accompanied or is due to the different components that are present in the cell wall that shows its biological effect that can lead to the disease or allergy or the immunity. Now, the human defense that usually comes forward to eliminate this particular infection is cell-mediated immunity, and hence only 1/10 of the individual is usually affected with this mycobacteria. As already discussed, there are different factors involved. Among these factors, the most important factor is the immune status of the person. If the immune status of the person is down or it is not active, in that case, the Mycobacterium tuberculosis has the ability to cause the infection. Otherwise, the cell-mediated immunity usually comes forward to eliminate the infection. So, human defense that is mounted against the Mycobacterium tuberculosis is the cell-mediated immunity. And the key cells that are involved is the CD4 plus helper T cells or the T helper cells. So, as we know that the T cells usually distinguishes into two different types of effector cell. One is the Th cell and the other one is a Tc cells. Th cells are the helper T cells that are the key cells in activating the other cells of the immune system, whereas the Tc cells are the one that are cytotoxic cells that eliminates the tumor cells or the virus infected cells. So in this particular aspect of Mycobacterium tuberculosis, it is the Th cells that usually comes forward to eliminate the infection. And the Th cells can again be produced via two important pathways generating Th1 cells or the Th2 cells. So the Th1 cell produces different types of cytokines such as interferons, gamma, interleukin 1, interleukin 2 and tumor necrosis factors. And these factors or the cytokines are the one that gives rise to a protective immunity to protect ourselves from the infection. Whereas the development of Th2 cells leads to progressive diseases and leads to delayed type of hypersensitivity reaction where there is no protection, and you can see the infection being taking place if there is a shift from Th1 to Th2 or if the T cell develops via the Th2 cells. So Th1 cells produces the cytokines, helps in activating the macrophages and eliminating the infection, giving rise to a protective immunity. Whereas the Th2 cells involved in the delay type of hypersensitivity reactions, tissue destruction and a progressive disease. That is, ultimately the patient will land up to the disease. And here the important feature of this organism is that it has the ability to multiply inside the alveolar macrophages and form a characteristic lesion which is called as a tubercle. And the tubercle can be identified as a avascular granuloma consisting of a central giant cell surrounded by lymphocytes and the fibroblast. And this leads to the lesions, producing the lesions which can be classified as exudative lesions or the productive lesions. Now coming to the lesions that are produced during the pathogenesis of this infection is the exudative lesions that is produced in the person where Th2 immunity is usually coming forward. So here exudative lesions are nothing but their acute inflammatory reaction are produced due to acute inflammatory reactions leading to edema, accumulation of the edema fluid or polymorphonuclear leukocytes and lymphocytes and the mononuclear cells. And coming to the productive lesions, they are usually produced by the cell mediated immunity, and they are the one that involved in the protective immunity. So if there is an exudative lesion, that is in the progression of the disease, towards the progression of the disease, where if it is a productive lesion, that it is an elimination of the disease. Now, based upon the time of infection, based upon the type of immune response that is given by the host, the tuberculosis can be classified as primary tuberculosis and post-primary tuberculosis or post-tuberculosis. Now, coming to the primary tuberculosis, in this particular patient, which are usually the young ones, taking place in an endemic area like India, the organism bacilli has the ability to enter into the lungs, where the alveolar macrophages engulf this organism, and they usually form the inflammation of the subpleural focus of the lower part or the lower lobe of the lungs or the lower part of the upper lobe. And here the involvement of the confocus is seen, and there is another involvement of the hilar lymph node, where there is an inflammatory response that can be seen in the hilar lymph node or enlargement of the hilar lymph node due to the antigen reactions. So based upon the time of the lesion, based upon the time of infection and the type of immune response that is present or produced by an individual, tuberculosis can be classified as primary tuberculosis or post-primary tuberculosis or reactivation of infection. So coming to the primary tuberculosis is the initial interaction with the organism or the initial tuberculosis where usually infects the young children in the endemic areas like the India. Here the organism, the bacilli enters into the lungs and are engulfed by the alveolar macrophages, and they usually result to subpleural focus of the lower lobe or the lower part of the upper lobe called as the gonfocus. So there is an involvement of the hilar lymph node, where there is enlargement of the hilar lymph node due to the reactions of the organism, and the gonfocus together with the hilar lymph node together is called as a primary complex. This primary complex develops within 3 to 8 weeks of the initial infection, and they are usually spontaneously eradicated or eliminated within 2 to 6 months, leaving behind a calcified nodules. And within 3 to 8 weeks, the person usually shows tuberculin hypersensitivity or a positive test. And within 2 to 6 months, they are spontaneously healed or leaving behind a calcified nodules. But the organism will have the ability to survive in the calcified nodule, where they are ready to cause a latent infection upon the secondary exposure. So when there is an immune compromised situation in a person, these organisms which are present in a latent form in the calcified nodule will have the ability to get reactivated and cause the infection. That is nothing but the post-primary infection. So in children, this is in a healthy individual, but in children who has an immunodeficient diseases or who are weak in their immune status, these primary infection can lead to miliary, meningeal or disseminated tuberculosis, causing extrapulmonary diseases. Now coming to the post-primary, that is the reactivation of the latent infection, which is an endogenous factor that helps in activation of the latent bacteria cause the infection, or it can be exogenous activation or the exogenous reactivation that includes the environmental factors, that is stress or the immunity of the person or the malnutrition, etc. So these are the exogenous factor that helps in activating the latent bacteria to cause the second infection, that is a post-primary infection, mostly seen in the adults. So it is a primary which is seen in the young children. The post-primary is seen in the adults where there is a reactivation of the latent infection. So here we have the differences between the primary and the post-primary is the production of the lesions. The lesions here in the post-primary are usually necrotic in nature, and there is a tissue destruction which leads to cavitation. So cavitation is unusual and lymph node involvement is unusual, and due to the cavitation the necrotic material will have the ability to pass on to the airways, which is the reason why there are bacteria in the expectorated sputum of the infected person. So the bacteria and expectorated bacterium laden sputum is usually seen in this person who is suffering from post-primary infection. And lymph node involvement is unusual, and usually in the case of immunodeficient patient, cavity formation will be unusual, and there is a dissemination of this lesion in the lungs and different parts of the bodies. So in the primary we have got the lesions that are usually produced that can be easily recovered within 2 to 6 months, but seen only in the immunodeficient children. Whereas post-primary there is a cavitation and there is necrotic material that usually sheds the bacteria in the airways, and which leads to the bacteria laden sputum, which is the one that is causing the infection to the other persons. Now coming to the epidemiology, this disease is said to be a very ancient disease where the Mycobacterium has been isolated from the spinal tuberculosis from the mummies, and they have also been like studies of DNA analysis where showed that the Mycobacterium had infected the mummies dated 1550 to 1080 AD also. And because of the more morbidity and mortality, this particular disease is said to be a global prevalence and is called as the white plague, or the captain of all the men of death. And coming to the statistics, this particular organism has the ability to infect about billions of people together whole worldwide, where it leads to that is 8 to 9 million people are suffering and have an open case of tuberculosis. And in case of India, it is a 15 million people who are usually affected every year, and 500,000 die because of this particular disease. And this disease is said to be the disease of a poor nation, or you can say that poverty and tuberculosis go hand in hand. Apart from this poverty, the another important factor which is causing more problem to the rich nation is the AIDS pandemic, because AIDS and HIV virus and tuberculosis are said to share certain important characteristic features. They are the one that are involved in the coexistence or the co-illness that is formed in a patient. So here HIV usually activates the latent infection, whereas the Mycobacterium tuberculosis hastens the HIV to get into the active diseases. So they both go hand in hand. So it is because of this two important factors, that is the HIV and the tuberculosis, the rich nations are also facing difficulty in treatment of this particular disease. This is not enough. To make the situation more worse or grave, there is an emergence of multiple drug resistant mycobacteria that is making the treatment more difficult for us. So here we have multiple drug resistant tuberculosis bacteria that has developed resistance against different types of antibiotics and making the treatment very difficult for us. Now coming to the Mycobacterium bovis, these organisms are usually the one, as already discussed, causes infection in the cattle, but also will have the ability to cause the infection in the humans when the human consumes the milk from the infected cow. If the milk is not pasteurized or not heated, when consumed can lead to the infection in the children. So it usually causes the primary infection in the cervical and the mesenteric lymph nodes, where it can disseminate to the bones and the joint, causing extrapulmonary diseases. Now because Mycobacterium and HIV, and because of the multiple drug resistance, there was a global emergency that was given by the World Health Organization in 1993 as this organism to be or the disease to be a global emergency disease. Now, next coming to the lab diagnosis, how do we identify this organism in the laboratory? This is the most important part in the treatment aspect. So, first we can go ahead with the microscopy, where the smears are usually done from the sputum to identify the organism by the acid-fast staining. And then you can go with the culture to isolate the organism in a pure culture, which can further be tested by the animal inoculation, that is in the experimental animals. And the other serological techniques that can be included are the tuberculoproteins or molecular diagnosis. Coming to the primary tuberculosis, here the most important specimen that is collected is the sputum. Here the sputum again should be from the patient, whether it is the patient is with a caseation like history, or whether he has a structured lesion. So in the caseation case, the sputum will contain the bacilli in abundant number, whereas in the structured lesion, very difficult to identify the organism, because the lesion will contain the organism and it will not allow the organism to come out for the smear technique. And the sputum has to be collected early in the morning, and it is best that the whole day 24-hour sputum has to be analyzed to identify the organism. In the case of like when there is a small amount of sputum that is coming up, then you can go with the laryngeal swabs or the bronchial washing. In the case of children who do not give the sputum voluntarily or who engulf the sputum, in that case you can go with the gastric lavage. Now, as soon as the sputum is collected, either it is taken directly for the microscopic technique, or it is concentrated to go ahead with the cultural technique or the animal inoculation. So, first coming to the microscopic technique, to identify the organism in the sputum. Here the sputum can be directly observed under the microscope, or it can be concentrated. And here in the sputum microscopy, the thick purulent part of the sputum has to be used to make a smear to identify the organism. And the staining technique, we cannot go with the gram staining, we have to go with the Ziel-Ninsen staining or the acid-fast staining. And 300 fields have to be observed, giving a positive or a negative report. So it should be that 10,000 acid-fast bacilli should be seen in 300 fields of this particular microscopy. And then gradation of the smear should be done to give a positive or a negative test. And the acid-fast staining, as already discussed, is with the help of carbon fustian, which is a primary stain. And the organism has to be slightly steamed in order that the carbon fustian has to enter into the organism, because there is mycolic acid that is present. It will open up to take up the primary stain. So once they have taken the primary stain, they do not get easily decolorized when we treat them with the dilute mineral acid. So after going with the primary stain, wash with the help of water, and then decolorize it with the 20% sulfuric acid or obsolete ethanol, or you can go with 97% ethanol and 3% HCl. Now after decolorization, go with the secondary staining technique with the Lowenstein or methylene blue, and then low flush methylene blue, which is a secondary stain, or go with the picric acid or malachite green. So based upon this, the organism will appear bright red in color. The Mycobacterium tuberculosis will appear bright red in color against a blue background when we use the methylene blue, or yellow when we are using the picric acid, or green when we are using the malachite green. So it is the bright red rods that are usually seen under the microscope that gives a positive test. So 300 fields have to be observed for 10 minutes before giving a positive or a negative test. So you have to identify 1 or 2 or minimum 1 to 9 cells to give a positive test within the 300 or the 10 field. Now you cannot go only with the normal microscopic technique, because there are many samples that has to be diagnosed. So in that case, we can move ahead with the more sophisticated technique, which is a fluorescent microscopy. So in the fluorescent microscopy, the stains mostly used are auromin phenol or auromin rhodomin, where the organism when stained will appear bright in color against a dark background. Now next is the concentration method, where the sputum has to be concentrated in order to go for the microscopic identification or for cultural inoculation or the animal inoculation. So when you are going for the cultural and the animal inoculation, you cannot directly take the sputum from the person and go for the culture. You have to concentrate it and then go for the cultural and the animal inoculation. And this cultural method can also be used to stain the organism and observe the with the help of microscope. microscopy. So for the concentration method, for microscopy we have different agents that usually will not distort the morphology of the organism but will kill the organism. So in that case of using the sputum in a concentration method, we can make use of chemicals like antiformin, sodium carbonate, we can use turgidol or flotation method with the help of hydrocarbons, or you can go for autoclaving. So these methods will destroy the organism but will not change the morphology. That can be used only for the microscopic technique. But for cultural method we need a live organism. So concentration method is different from the microscopic concentration method. So for cultural and animal inoculation we can go with the Petrov's method. In the Petrov methods, the sputum is mixed with 4% NaOH and slightly shaked for every 20 minutes at 37 degrees centigrade till a clear solution is formed. Now once a clear solution is formed, it is centrifuged at 300 rpm again for 20 minutes, and the sediment is treated with N/10 HCl, and this is mostly used for either microscopic technique or for the cultural method or animal inoculation. The alternative method that avoids the centrifugation method is incubating the equal amount of sputum with 20 grams cetrimonium bromide and 40 grams NaOH, and the 0.2 ml of the inoculum is usually layered over the acid buffered medium, which is called as the International Union Against Tuberculosis medium, or the LJ medium. And the same swab can be used after mixing and can be used to make a smear on the plate. Now coming to the cultural identification, as already discussed, the cultural morphology of the organism. The organism has to be inoculated onto 2 IU-AT-LJ medium, that is International Union Against Tuberculosis Lowenstein-Jensen medium without the starch. And once the microscopic technique shows a positive reaction, immediately go for the drug sensitivity testing, because most of this organism has developed resistance against the different antibiotics. So in that case we should be very well aware whether the organism is a resistant organism or a sensitive organism to go for the treatment. Once inoculated onto the media, and examine the media continuously for every 4 days, then 8 days, and up to 8 to 12 days. That is initially starting with once in a week, twice in a week, till about to 8 to 12 weeks. Positive report should not be given before 8 to 12 weeks. Negative after 12 weeks it is a negative, and if there is any growth in the medium, then it is a positive test. After the growth of the organism, then you go for the microscopic smear technique, that is Ziehl-Neelsen method, to identify the organism. Now as based on the cultural characteristic, how do you identify organism? The slow growth, one important characteristic of the organism. They are non-pigmented and they are niacin positive, acid fast bacilli. This indicates the characteristic of the organism, that is a Mycobacterium tuberculosis. Further confirmation can be done by the biochemical tests. That is all tests that we have seen in the biochemical reactions. And then you can go again with the molecular techniques or the other techniques to finally identify the organisms. Because this organism is highly fatal in nature, you cannot rush to give a positive report to the patient. Now in the liquid media, as already discussed, there are different media that can be used to identify the organism or isolate the organism, and the easiest method to give the result early, not taking 8 to 12 weeks, is the radiometric method, that is using the Bactec 460. So here we can cut down the time from 8 to 12 weeks to 4 to 6 weeks. And apart from that, you can go for the nucleic acid probes to identify the causative agent, which is a more sophisticated technique and is available only in the most sophisticated lab. Now next is the sensitivity testing. Once we have identified the organism as a pure culture, we should go for the sensitivity testing, because this organism has the ability to develop drug resistance against different types of antibiotics. So the sensitivity testing is usually done in 3 ways. One is the absolute concentration method, resistance ratio method, and the proportion method. In the absolute concentration method, a series of the plates having greater concentration of antibiotics are inoculated and minimum inhibitory concentration is identified for the treatment purpose. Next is a resistant ratio method, where we are making use of only two plates. One plate will contain the test organism, the other will contain the standard organism, and both will have a graded concentration of the antibiotics. So based on this, you will know with the standard organism, you will know whether the organism is a resistant organism or a sensitive organism. And the third one is a proportion method, that helps us to know the average sensitivity of the organism, keeping in mind the logic that in a particular population, different cells will have sensitivity towards different concentration of the antibiotic. That is a proportion method. Irrespective of whatever the method that we are using, it helps in identifying whether the organism is a multiple drug resistant tuberculosis or it is a sensitive organism towards the antibiotics. Now once we have done with this sensitivity testing, then go ahead with another test, that is the animal inoculation. The animal that is selected is a guinea pig, where we can introduce the pure culture that we have isolated into the organism via the intermuscular. Some subcutaneous injection cannot be done because that can cause the infection in the organism and will not give a positive test to us. So it is mostly due to the intramuscular injection that we will be able to identify the organism. And two guinea pigs are usually used here, which are introduced intramuscularly with the pure culture, and their weight have to be checked for every few days. Continuous loss of weight indicates a positive reaction, and the guinea pigs also shows a tuberculin reaction that indicates a positive test for the tuberculosis. And one of the guinea pig have to be killed 4 weeks to identify the positive or the negative tuberculosis, and the next animal will be killed after 8 weeks. And here after the autopsy that is done, you can see the enlargement of the spleen, having the necrotic areas, enlargement of the lymph nodes, having caseations, etc. So this helps in identifying whether the organism was tuberculosis or any other species that is involved in the disease. The most sophisticated technique is nucleic acid technique, where we can make use of the polymerase chain reaction or ligase chain reaction, transcriptional mediated amplification, targeting ribosomal RNA or RFLP, restriction fragment length polymorphism, and IS fingerprinting. All these are the techniques because we know the whole genome of the Mycobacterium tuberculosis. With the help of that knowledge, we can identify the strain of the organism that is causing that particular disease. Another important thing that we can do to identify the organism is the immunodiagnosis. Though it is not very actively used to identify the infection, but sometimes these are also used to identify the organism. So antibodies are produced against the different components of the organism, that is towards the protein, toward the lipopolysaccharide or the phosphatide. So antibodies, in the case of these patients, the sera of the patient contains antibodies against lipoarabinomannan. So this can be used to identify the organism. Another important thing is the tuberculin testing, where the tuberculin protein of the organism that has been purified, called as the PPD, purified protein derivative, can be introduced on the flexi for part of the forearm, and this particular test is called as a Montex test, and observed for 24 to 48 hours. Any duration of about 10 mm can be taken as a positive test. So this indicates the active infection or the active immunization in the young children. So tuberculin testing can also be used to identify the organism, but it is not having that much importance as we go for the cultural testing. Now coming to the extrapulmonary tuberculosis, extrapulmonary is the one where the lungs are not involved and mostly caused by the Mycobacterium bovis. Here the specimens that can be used is a cerebrospinal fluid from the meningitis tuberculosis or tuberculosis meningitis, and the identification is a spider web clot is seen that gives a positive reaction. So in order to further confirm it, you can go for PCR or DNA fingerprinting, and in case of bone marrow or the liver, either biopsy to identify the miliary tuberculosis. And in case of HIV patient, you can go with the blood. Culture can be done to identify the organism. And for pleural exudate or effusion or exudate from the other important organs, they have to be isolated or they can be extracted using a citrate, which is an anticoagulant. If any bacterial infection is there apart from the mycobacteria, that has to be eliminated by the concentration method and can be used to produce the pure culture in the cultural media. So pleural effusions have to be extracted with the citrate and then inoculated onto the culture media. Now coming to the pus, again similar thing, the pus have to be identified for the microscopic technique where we can easily identify the organism with the help of Ziehl-Neelsen method. And urinary excretion is intermittent. You cannot take one urinary or urine sample to identify the organism. 3 to 6 samples for 3 to 6 days have to be used to identify the organism. So urine has to be collected, centrifuged, and the sediment has to be used to culture to identify the organism. Now coming to the prophylaxis, prophylaxis is the control of the organism. General measures have to be taken like before giving the treatment. The treatment is not possible until unless the immune status of the person is very good. So the person has to be given fresh air, he has to be given with good nutrition, and there should not be any stress that should be given to the person. So it is with these particular factors that treatment can come out as a positive result. So the general measures includes the chemoprophylaxis or immunoprophylaxis. So among the immunoprophylaxis, we have the BCG vaccination that is produced by Calmette and Guerin and called as Bacillus calmette guerin, produced from the Mycobacterium bovis. So Mycobacterium bovis can be cultured frequently on a media. About 25 generations are cultured on an appropriate medium, inappropriate medium, so that the virulent forms converts to avirulent form. And from this avirulent form, we can prepare the vaccine and can be given to the children. It usually provides immunity to about 10 to 12 years, after which the active immunity itself come forward to protect the person until unless his immune status goes down to cause the infection. It is said that the BCG usually does not give protection against the disease but prevents the spread of the diseases to different parts of the body. Irrespective of whatever it is, the BCG is usually given to the children among the India to prevent from this fatal diseases. Now coming to the chemoprophylaxis, that is the treatment of the infection with the antibiotics, you can go with isoniazid. It is the only drug that is used in treatment of this particular infection. Now coming to the treatment aspect, treating with the different types of antibiotics, which is called as a chemotherapy. The chemotherapeutic agents usually are classified into two types, bactericidal types and the bacteristatic types. Bactericidal are the one that inhibits the growth of the organism, whereas the bacteristatic are the one that usually kills the organism. So in the case of Mycobacterium tuberculosis, a combination of these two drugs are usually given to completely eliminate the organism. So coming to the bactericidal drugs that are mostly given are called as rifampicin and pyrazinamide, which are the one that can sterilize the lesion, that is kill the organism in the lesion, whereas isoniazid acts only on the replicating bacilli. And streptomycin is the one that acts on the extracellular, and the bacteriostatic agent that is given along with the bactericidal is the ethambutol. So bactericidal and the bacteriostatic together includes the first line of treatment. So this is usually given to the patient who are suffering from the initial infection, and this has to be carried out for 6 to 7 months course, and a combination of HRZD is usually given, that is isoniazid, rifampicin, pyrazinamide and ethambutol are usually given as a first line of the treatment. So once it is goes up to 6 to 7 months, then it can be reduced to only HNR for about 2 months for a period of the infection that is usually present inside the person. Now, because of the drug resistance, the organism has developed drug resistance towards different types of antibiotic. The organisms have been called as multiple drug resistant tuberculosis, and hence multiple drug therapy has to be given to eliminate this organism, which is usually involved in the morbidity and the mortality. Bactericidal and bacteriostatic drugs are usually given as a first line of treatment, where a combination of isoniazid, rifampicin, parazinamide and ethambutonol are usually given in combination. So initially when the person is tested positive in the smear, the treatment should be started, and it is with the HRZD combination twice, 2 times for a week, and goes up to 2 months, and this is called as the intensive period, where it is followed by the continual period with only 2 drugs, H and R, for continuing about 4 to 5 months, 3 times a week again. Now coming to the drug resistance, the drug resistance in the organism is mostly due to the mutations in the organism, and apart from mutation, the other factor that makes the organism mutant is incomplete treatment or incomplete taking of the medicine by the patient compliances, drug deliveries. These are the reason why the organism has become strong and drug resistant against different types of antibiotics. So based upon the drug resistant and how the person gets infected, the drug resistant organism can be classified as the primary or the secondary. If the patient is infected with the organism that is already a drug resistant organism, it is called as a primary, and pre-treatment should be given. And in case of secondary, it is during the treatment that the organism becomes resistant, and it is mostly the secondary drug resistant that is common among the organism, because the person who is on this particular treatment will not completely take the dosage and complete the treatment, and in that case it so happens that the organism become resistant towards the different types of antibiotics. And in that case, nowadays we are going ahead with the drug resistant tuberculosis, multiple drug therapy against the multiple drug resistant tuberculosis, and mostly the organism develops resistant against the rifampicin and the isoniazid, which are usually given for a short duration of time, and it forms a sheet of anchor during the treatment. So once if the organism develops a resistance against this, it is that the treatment becomes very difficult to treat this particular infection. So the multiple drug resistant tuberculosis is because of the resistance against the rifampicin and the isoniazid, which are usually given for a short period of time. And apart from that, you can go for the directly observed therapy dots, where you keep the patient under the observation and go for the treatment, so that he does not transfer the infection to the other person, and keeping all the condition in his favorable form to eliminate the infection and treat the person. And nowadays we can go with the transfer factor, where we know that it is a cell mediated immunity that usually coming forward to eliminate the infection. So transfer factor is nothing but the immunity or the passive immunity given via the T cells. So this is also in practice nowadays to fight against the tuberculosis, to eliminate the tuberculosis infection. So this is all about the Mycobacterium tuberculosis, which is a very fatal disease.